Welcome you all on this educational program on chronic kidney disease and pedal edema. I am Dr. Shekhar Shiradhonkar, consultant nephrologist at St. Nandalal Dhuth Hospital, Aurangabad. Today I am going to talk to you about chronic kidney disease and its important symptom, that is pedal edema. As we all know, kidneys are the organs which help to excrete the various metabolites from our body. It helps to maintain the water balance, acid-base balance, electrolyte balance. It helps to improve the hemoglobin by producing red blood cells, and it also helps to maintain the various calcium and phosphorus metabolism. As we all know, whenever there is a kidney disease, the kidney disease is divided into 5 stages. When the kidney is functioning more than 90%, we call it as stage 1 CKD. When the function is between 60 to 90, it is stage 2. When it is between 30 to 60, it is stage 3. When it is between 15 to 30, it is stage 4. And the stage 5 is when the kidneys are working only below 15%. At this time, most of the patients will show various symptoms related to chronic kidney disease. As we all know, the various symptoms which are seen in chronic kidney disease, the important symptom is swelling over the body or swelling over the legs and face, that is the edema. Then the other symptoms are loss of appetite, vomitings, nausea, loss of sleep, then frequent micturition or frequently passing the urine at the night time. Sometimes there is a decreased urine output, and the various other issues like gastrointestinal symptoms are also present. But the important symptom, that is the pedal edema. Today we are going to talk about this edema, its causes, its symptoms, its causes, and the various treatment modalities available for this entity. As we all know, this edema, it is the part of the chronic kidney disease element, and when we see edema, it is the presence of fluid in the various tissues like in the legs, in the face, and the various compartments in the thorax and the abdomen. The important causes of this edema formation are two, that is the loss of protein from the body, that is as we see in the cases of nephrotic syndrome, there is loss of albumin, globulin in the urine, and which leads to formation of the edema. As the protein is lost in the urine, the generally blood pressure falls, and the kidney says that it is the fall in the blood pressure. They try to retain salt and water in the body, which ultimately leads to the formation of edema. The other important cause is declining kidney function. Whenever kidneys are not able to excrete the whole amount of water from the body, then there is again edema formation. And the edema is generally seen on the dependent areas like on the legs, then in the face there is the periorbital edema, and the various other body organs like pleura or in the peritoneum, there is a fluid collection leading to pleural effusions or ascitic formation. So when we come to the important aspects of this edema, we have to consider the two things, that is the treatment of the underlying cause and the treatment of the edema itself. When we talk about the treatment of the underlying cause, if there is a nephrotic syndrome, we have to treat with the immunosuppression like steroids and some other medicines, or if there is a declining function because of hypertension and diabetes, we have to treat the basic underlying diseases. Coming to the treatment of the edema, there are 4 modalities of treatment for this entity. First is the salt restriction and water restriction. As we all know, there is a salt retention and water retention in the formation of edema. We have to control this by decreasing the salt intake as well as the fluid intake. The second aspect is to give the proper position of the legs so that there is a distribution of the fluids from the legs. So we have to ask the patient to lift the legs while sleeping almost around 30 degree above the heart level, so that this water from the legs can be come into the circulation and it can be excreted to the urine. The third important modality is the compression stockings. If patient is able to use a particular size of the stockings for the legs, there will be increased pressure on the leg veins, and this will also cause the improve the circulation, leading to the edema regression. But the most important treatment modality for this pedal edema is the treatment with medicines, and the medicines which are used to reduce edema are diuretics, that is the loop diuretics as well as the other diuretics, and we can give single drug or with the combination. But the diuretics, as they reduce the water from the body, they also cause salt or electrolyte imbalance also. So we have to use these drugs judiciously or with the combination with the other drugs, and we have to tell the patient to restrict salt and water along with these medications to get the proper result from these medicines. Thank you.